I'm Dr. Baker with Omaha TMJ Clinic. I want to talk to you today about TMJ dysfunction, which is a very common problem that causes the jaw to go out of balance. Now, in order to understand how and why the jaw goes out of balance, it's extremely important to understand the anatomy. The TMJ, or the jaw, is a connection between the jawbone, called the mandible, and the skull. There's a small cartilage disc that separates these two bones. From there's a lot of muscles that connect to the jaw from the neck and from the face. Since the TMJ is a joint, its main purpose is to move. It moves when you talk, chew, or yawn. There are two primary motions of the jaw. Let's take a closer look. The first movement of the jaw is rotation. Now, the primary movement of talking actually includes most of rotation. Once this rotation is used up, the second movement is actually gliding. When the TMJ is working well, the brain will send messages to the muscles to open up both sides of the jaw at exactly the same pace. Think of this like a computer program. When the TMJ becomes dysfunctional, the brain's program gets mixed up, and the muscles become uncoordinated from side to side. Now, this can actually pull the chin or the jawbone out of alignment and cause the jaw to have really bad tracking. This sometimes causes a popping or a clicking noise. Now, if this faulty pattern is left untreated or is not treated correctly, it can actually cause that little cartilage disc to wear and further degenerate the joint. Now, if you leave this untreated long enough, sometimes surgery is the only way to repair the damage. Now, in TMJ dysfunction, there's four common patterns that we see. The first pattern is what we call a C-shaped pattern. Now, this is when you start to open your jaw, one side will become dominant, and it'll start to pull. The chin will actually start to pull over to that side, and then it'll come back to the center, creating a C shape. Now, this is usually the most common and the easiest one to fix. The second pattern is what we call an S shape, and this is when both sides are dominant, but at different times. So what happens is when you start to open the jaw, the chin will slide to the first dominant side, and then it'll come all the way across to the other dominant side, finishing out in the center, creating that S-type shape curve. Now, in really chronic patterns, this can even turn into a zigzag. The third pattern isn't a side-to-side, actually. It's more of a twerking pattern. Now, this is when you open the jaw, the chin is actually twisting when it starts to go. Now, this is a much more complex pattern to fix, and it usually has a loud pop or click noise associated with it. The fourth pattern that we see isn't a side-to-side pattern. It's actually an imbalance between the really strong clenching muscles and the really weak opening muscles of the jaw. Now, these patients usually have trouble fully opening their mouth. They can have pain on one or both sides, and these usually do not have a popping or clicking associated with them. Now that you understand a little bit about what causes the TMJ to become dysfunctional, I'd like to talk about active alignment therapy, or AAT for short. The goal of this therapy is to help you regain and rebalance the control on both sides of these jaw muscles. We do that through using specific exercises and myofascial release. What this is going to do is it's going to reset the program in your brain back to a normal balanced pattern. Active alignment therapy is going to fix the primary cause of most TMJ conditions. Now, some patients have taken a lot of the other treatments out there, including mouth guards and splints. The problem with these is that they only align the jaw when your jaw is closed. Again, the jaw is a joint. The whole purpose of a joint is to move. So as soon as you open your jaw, a mouth guard is no longer effective. Some patients will also take drugs to help some of their symptoms, which can be very beneficial, but it's not going to do anything to retrain the balance on your jaw. Finally, surgery should really only be used as a last resort once every other option has been exhausted. Once you've done surgery, you can't undo it. If you'd like more information about active alignment therapy, please call me, Dr. Baker, at 402-397-1800 and make an appointment to come in. What we'll do is we'll look at your jaw and we'll examine it, discover if you're going to be a good candidate for AAT, and if so, we'll go through and explain what your pattern is and what it'll take to treat it.